My loved one has been clinically diagnosed with dementia. Now, what do? Do I move my loved one in with me and my family? Do I move my loved one into a nursing facility? Or do I go and hire someone to be with my loved one all the time, 24 hours a day? What do I do after I get that clinical diagnosis of dementia? Well, all of these options are very viable considerations, but before you start thinking about long-term as the disease progresses, you want to first find out what type of dementia it is. Yeah, there are over 100 types or 100 causes of dementia. Alzheimer's disease is the number one type of dementia, but there are 3 other ones that you want to be mindful of. Hi there, everybody. I'm Dr. Macie Smith, the social gerontologist providing education, training, and caregiver coaching to help you and your families reach the next level of care. Your loved one has been clinically diagnosed with dementia, and you want to know, what are the next steps? What do? Do I move my loved one in with me and my family? Do I move my loved one into a nursing facility? Or do I hire someone to be with my loved one 24 hours a day, providing nonstop care? These are very valid considerations to be mindful of, especially as the disease progresses. But before you start planning long-term and becoming very anxious about the level of care your loved one is going to need, you want to find out what type of dementia your loved one has. Alzheimer's disease is the number one cause of dementia, but there are 3 other causes of dementia that have been diagnosed more often than you may think. The second largest type of dementia is vascular dementia, caused by vascular conditions such as a stroke. The third largest type of dementia is dementia with Lewy bodies. And the fourth largest type of dementia is frontotemporal dementia. Why is it important for you to know what type of dementia your loved one has? Is it easy for the doctor to diagnose? It may not be easy for the doctor to diagnose what type of dementia your loved one has, but it absolutely is worth asking the clinical professional what type of dementia your loved one could possibly have. That's going to help you identify strategies to ensure that your loved one has a fruitful quality of life. And it's also going to help you as a caregiver continue to engage with your loved one at a level that's amenable for the both of you. So that way, neither would be stressed or strained when it comes to care. Once you are aware of what you need to do and how you need to do it, it will alleviate a lot of those unnecessary stressors. So you have a diagnosis of dementia. You've asked the doctor what type of dementia it is. The very next thing you need to do is get connected. You want to get connected with that particular organization or association or group that specializes in that type of dementia. If the person has Alzheimer's disease, you want to connect with the Alzheimer's Association. You want to connect with the association that manages vascular dementia. There is also an association that specifically addresses dementia with Lewy bodies. And then there's the Association for Frontotemporal Degeneration, which typically happens prior to the age of 60, which means it's early onset dementia. Once you're connected with those organizations, you will have unlimited access to information, education, and support groups because you're going to need it. And then you want to ensure that you are up to date on non-pharmacological strategies, non-prescription strategies, meaning outside of medications, which are only going to treat the symptoms of the actual disease. And at some point in time, those medications may not be as effective. What is effective is the care that you provide. When there's not a cure, there's care, and that care is through communication efforts. You are going to want to know how to effectively engage with your loved one who has this progressive type of dementia. You're going to learn those strategies in those support groups that you are a member of. You want to be sure that you're engaged. You want to be sure that you ask questions, very simple questions such as, if my loved one starts to repeat themselves, how do I respond? How do I respond if my loved one starts to hallucinate or have paranoia or is accusatory? You want to know how to respond. You're not going to respond in a typical manner because you're managing the care of someone who has a cognitive impairment, who's not seeing your reality, but they're seeing their reality. We have to step into their reality and manage their care and communicate and engage with them in a manner that's a reality to them, that's comforting to them. And so it's very important that you learn communication strategies. For these tips and more, be sure to subscribe to my YouTube page and click the bell so that way you know when I upload a new video. And don't be afraid to leave a comment. I do read them and I do respond. Until next time.